As students around the country head back to the classroom amid the pandemic, a major concern is how to keep children and staff safe. Some school districts have been experimenting with a method called pooled testing, a process meant to help limit the spread of COVID-19 in schools while minimizing the cost and time of frequent large-scale testing. Politico education reporter Bianca Quilantan is here to discuss. All right, Bianca, I have heard of pool testing, and I think I watched a video where they were explaining it, but I still don't quite have it I haven't grasped it completely. So explain pool testing to us.
Yeah, sure. So, I mean, the word sounds complicated, but it really isn't. So, basically, a pool is an individual classroom of up to 25 kids. All those kids in those classrooms will swab their own noses, 4 circles in the left, 4 circles in the right, and then they'll walk to the front of the class and put it in a single sample tube. That sample tube, then the school officials will come and pick up that sample tube, and then they'll hand it off to a courier who will take it to a lab. It's pooled because only one COVID test is used for each pool, which cuts down the cost. It's more expensive to test kids individually than it is to just use a single COVID test. However, after this is sent to the lab will test it for COVID, right? And then schools will know the results in less than 48 hours. Some school districts have told me that they hear back the night of, too. So then they can put these mitigation protocols they have in place, like quarantining or, testing every kid in that classroom individually so there's no COVID spread.
So I presume that this is cheaper. How much does this process cost versus testing, each kid individually? And who's paying for it? Or how is it being paid for?
Yeah, sure. So, Massachusetts is the only state to have conducted this whole pooled testing statewide. They say that their contract for 6 weeks, well, for the first 6 weeks is $15 million to $30 million. Some school districts are going to take up that protocol on their own after the 6 weeks is up at the end of this month. And from the school districts that I've spoken to, they say that it costs them $5 million, $5.7 million in their own school. They're using those federal stimulus bill money in order to pay for this program.
So I can see how that works with, the elementary school kids. They all stay together. In my kids' school, it's called in the same cohort. They call them cohorts. But, as the kids get older, typically they move from class to class, particularly high school. Would it work in that kind of environment?
So far, I don't think so. From who I've spoken to, especially Baltimore City Public Schools, they said that high schoolers are not in the same classroom and they cannot, test them that way. High schoolers have to be tested individually and they're tracked individually, which is more costly. They actually had some foundations come by and donate money in order to help them fund that part of the program. So it will be more expensive to test high schoolers if we want to get them back to school. It's more concentrated on the K-8 level where they are in the same classroom.
So you sort of described kids doing their own swabbing. I don't know if that's the plan kind of across the board. What about, much younger kids like kindergartners? I guess they could still do it, but are parents how are parents reacting to this? Are there concerns that maybe the kids won't be able to swab properly or that staff would be getting involved and they're not trained medical professionals?
Sure. So in Massachusetts, the level is second grade and down. We'll have someone help them out. So they'll have a school nurse come by. We know that there have been school nurse shortages before. So this is a question that I did ask in my reporting. And so, some school officials will have also that same responsibility in helping those students. But largely the students are able to do it on their own because it's so simple. A lot of parents were initially concerned that it was going to be like that first COVID test, the brain poker where they would have to shove it all the way up their nose.
Right.
It's different. It's shallow this time.
So you mentioned that, in Massachusetts, they've been doing this. How is it working out? I mean, what have the results been?
Sure. Governor Baker has, praised it. He actually released some of the results this week. They have, of 22,000 pools, less than 1% have tested positive. So Massachusetts found that low positivity rate in their schools, and they say that this is a tool that has really helped them reopen. It could provide a framework for what a national testing strategy could look like across the country. Biden has pitched a $10 billion plan from the American Rescue Plan, where they will be able to implement this pool, some kind of testing to test asymptomatic kids who want to return to school.
You know, if it works, and it sounds like it is, I think it's brilliant. You know, I have a daughter in school. She's been basically in school, in classroom learning, but there have been some spikes here and there. And there was most recently, I think, 4 cases of COVID discovered. So now she's at home. But I suspect that part of the way that's discovered is because, you know, somebody in a household started to get symptoms, and so they took a test. They came back positive, and so they tested other people. It's kind of reactive versus this, which sounds sort of very proactive. So it could really be a game changer. Bianca, thank you very much.
Thanks for having me.